Today on LA Currents. First elected in 2013, Eric Garcetti is now concluding his tenure as mayor of LA. In our final sit-down interview, Garcetti talks about his accomplishments and his hopes for the future of Los Angeles. Next, affordable housing is a trending hot topic here in Los Angeles. LA County Supervisor Hilda Solis shares her thoughts and plans on how we can better address this growing concern. But to start, when Kedren Community Health Center was overlooked in the initial distribution of vaccine supplies, Dr. Jerry Abraham took action. Our Anita Bennett speaks with him about his efforts and the importance of getting everyone vaccinated.
Health officials here in Los Angeles are urging those eligible to get the updated Omicron booster shot. Now, those shots are available in more than 1,500 locations across the county. And one of those sites is Kedren Community Health Center in South Los Angeles. Joining us to discuss this is Dr. Jerry Abraham. You are the Director of Vaccines at Kedren. So what is happening at Kedren? Are a lot of people coming out to get this booster shot?
That is what we've been doing at Kedren, is making sure that Black and brown populations that are often hard to reach, hardly reached, have access to COVID-19 resources. And that's still what we're doing today. We have vaccinated nearly 400,000 people and tested hundreds of thousands of folks. We've also now provided therapeutics. You might have heard of Paxlovid, some other interventions. We do a lot of community engagement and patient education, along with really making sure that our communities are pandemic ready, including dealing with the realities that people are still living with COVID.
When the pandemic first started and the vaccine first came out, I remember visiting Kedren, and there were people coming from all over, Orange County, other countries. How do you make sure that the local folks get the vaccines that they need?
Absolutely. If you remember those honestly kind of dark days, it felt like a boarding gate at LAX where there were zones, priority 1, 2, 3. We wanted grandma and grandma to walk right through. Those who had mobility issues or couldn't see, couldn't talk, couldn't walk, those folks came right through as well. We also made sure that we piloted those from the zip codes hardest hit. For example, in South Central and South LA, we're able to walk right in and get their shots. And so that's really how we made sure we prioritized those with the greatest need come first. And that's really what health equity and also righting the wrongs of racism in the past as we address racial justice is to make sure Black and brown populations, you should be first in line to get these treatments. They are for everyone.
You and your team went to churches.
Absolutely.
You took the vaccine.
Absolutely. Oh, it was like an altar call. Oh, yes. The minister would ask us to come up and speak. And then we would say, these vaccines are for you. They're not just for rich people or white people. People needed to hear that. They needed to know that. They needed to see their pastors, their leaders, their teachers, their coaches, their respected elders getting vaccinated in front of them. And that built trust. And we'd literally be in the back of the congregation. And as people are ushering out of services, they were rolling up their sleeves and getting their shots. People go to church and they get healing, for their soul. We wanted to also provide healing for their bodies. There's a beautiful space that we can be at in sacred spaces like churches, but also in educational spaces like schools. People go to work. Why not meet them where they are going and they're bending over backwards to put food on their own tables and keep a roof over their head? Let's make it easy for them. Let's come to them and help them there. It's not brain surgery. It's not rocket science. I don't know why it's taken so long for us to get here.
Did you work at all with the councilman's office?
Absolutely, yeah. This has been nothing short of a labor of love, and all of us having to come together with the city and the county and the state and at times the feds. And that's what scares us now. As President Biden, I truly believe, carelessly or recklessly said the pandemic is over, that has real implications for whether or not people in our community are choosing to get these Omicron bivalent boosters. And that's damaging and hurtful. And we're very concerned with federal resources coming out of COVID. Will my people have access to tests, to therapeutics, to vaccines? That's scary. So the commitment we're making from Governor Gavin Newsom's office on down, from the California Department of Public Health assuring us, don't worry, we will make sure you have those resources, especially for Black and brown communities right here in South and East and Southeast LA, are really critical messages. And we're hearing that from our local county supervisors in the Department of Public Health right here in Los Angeles, and from Mayor Garcetti, and from Councilman Price, Marquise Harris Dawson, and multiple others that have stepped up to make sure that our people continue to get the resources and the care that they need and deserve. Our people deserve to live just as much as everyone else, and our goal, as I always say, best life, longest life, healthiest life, happiest life, that's for everyone, regardless of your socioeconomic status or what race or ethnicity you are.
And you mentioned some of the conspiracy theories. I mean, I've heard it all. Like you said, there's chips in the vaccine. How do you dispel those myths?
Part of it is understanding that some people need to hear it multiple times. For some, it may be 1 or 2 times. For others, they really need to feel comfortable. It might take up to 15 times. My team is out there every day with street medicine and mobile medicine. We have been threatened. We've been told to leave our community. Don't you bring those vaccines to our community. We're in gang territory as well, right? So there's a lot of those kind of safety concerns and risks. Some of those individuals over time have changed their hearts. They've softened their stance. In fact, some of those folks have actually gotten vaccinated. It's because we built trust. They knew we weren't here just to tell you to roll up your sleeves, trust us, take this medicine, never see us again. That's not what health and being healthy is all about. We need to be ever present. We need to be an institution that can be trusted. And that trust really was missing, which is why it was so hard in the beginning to really get Black and brown individuals to come out. And really briefly, I've talked about this before, the medicalization of racism. So when we talk about the Tuskegee trials, where Black men were denied treatment of syphilis, Latinas were denied good care here at LA County, where they were sterilized against their risk. Black individuals are not treated for pain equally or appropriately in our hospitals. These are real, these are lived experiences. I think of Henrietta Lacks, her DNA abuse, her family not getting credit. So when you ask people why are they not coming, I don't think that's a fair question. You're putting the burden on them. I think we have to say, acknowledge this and say we totally get why. We have a much longer journey that we need to cross together for you to trust us in order to take our recommendations seriously.
How do you think we did here in LA in terms of addressing the pandemic?
I think the county had made an equity committee, and that helped tremendously. Many of us came together with the County Department of Public Health, the city councilors, the mayor stepped up, the supervisor stepped up. In many ways, we were committed to not making the same mistakes as Chicago, Washington, D.C., many other jurisdictions where the vaccines landed in the exact opposite zip code of where the suffering and the COVID were.
More affluent communities.
We looked at geographic data. We looked at where COVID was. We did some geo mapping, and we said we're going to take them to these zip codes, we're going to take them to these communities, these households. Imagine if one person had COVID in your house, don't you think that makes sense to get that whole house vaccinated? Because they've already demonstrated they're at highest risk. And so by implementing many of these very smart strategies, rather than sitting in a room doing whiteboard exercises, calling consultants, we were real-time informing the process. And I really believe because of that, many people were saved, many people did not catch COVID, and we did not have the deaths and the suffering that could have been had we not taken equity seriously.
What illnesses do you see the most often?
Well, one of them, the trifecta I call it, is diabetes, hypertension, and hypercholesterolemia. And high cholesterol leads to strokes and heart attacks. Those three often go together, and they're very much so lifestyle illnesses. We're not moving as much as we used to. We're eating processed and fast foods, more oils and fats than ever before. So we're not surprised that we're seeing these diseases of luxury that, our predecessors have not had to deal with. And so we really need to figure out a way how to address that. These enormous amounts of calories that we're faced with, and then the lack of movement, all of this is resulting in disease and disproportionately affecting those that are lower socioeconomic status and definitely communities of color. So we need to get better about how we're going to tackle that epidemic. So one of the best things that we can do is we need to schedule those preventive maintenance appointments, go in and kind of, just like you get your car tuned up, it's time to kind of really see, where am I at? Have I screened myself for all those cancers, colon cancer, breast cancer, cervical cancer? These are all things that now that, we've got a chance to breathe, the COVID numbers are down, let's catch up on all that missed care that we all need and deserve. So again,
From
live
2
our
years of the
longest,
pandemic
healthiest,
to it,
best,
yeah.
highest quality life. And that should be, as the physician, that I hope is all of our goal in the healthcare side. Patients too. So when we align those incentives and goals, I feel like that's how we're actually going to get there.
He's the 42nd mayor of Los Angeles, who previously served on the LA City Council, including 6 years as council president. We met up with Eric Garcetti for a look back at his time in public service for the city. Well, today I am delighted to be joined by a classically trained pianist, but more importantly, the wonderful 42nd mayor of the city of Los Angeles, Eric Garcetti. So nice to have you here. I had no idea that you were a classically trained pianist, by the way.
Yeah, actually my great grandparents played the piano. My grandparents on my mom's side met in piano school, Eastman School of Music, and my mom played. So I was just kind of continuing the family tradition, and while I've been mayor, I've kept the piano in my office for almost the entire 9.5 years.
Very cool. All right. 9 years being the mayor. Obviously, there are an enormous amount of things that you could have not have predicted, pandemics, etc. But walking into the job, have there been things that you expected, and did it live up to your expectations?
I'm one of these people who's superstitious and never guesses what it's going to be like. Because I always experience in life, whatever you think something's going to be like, it's going to surprise you and maybe be the opposite. So when I was running for office, I never pictured it. I kind of waited till I was here on day one. Obviously, the building was familiar. 12 years I had served as a local public servant. But coming downstairs from the 4th floor, where the city council offices are, to the 3rd floor here, was almost like going into a different world. Going from the legislative branch to the executive branch, it never ceased and ceases to amaze me just how different the job is and how exciting it is. There is probably 100 decisions a week that equaled the number of big decisions I'd make in a year as a council member. So you have to be ready to run 41 departments. You have to be comfortable being an executive. This was my first executive position, and I loved being an executive because the speed with which you can act is just so different. The way you can set a vision and explain a moment. Those things to me really were totally different than anything I had done, and were not only a surprise, but a pleasant surprise, I'd say 90% of the time.
How is that even physically possible for somebody who is the mayor of a city as large and complex as Los Angeles?
Well, the honest answer is it's impossible. Anybody who thinks they can know everything, learn everything, and do everything won't be successful in this job. I'm ambitious about policy, and I want to know everything. It's my nature. Don't just tell me 2 things I'm going to do as mayor. I want to do things in all 41 departments and multiple things in each. A Green New Deal that has over 460 pledges in it. Looking at understanding how the street paving material gets made and what the impact is on the environment. So I kind of split my time into 4 things. 1, getting briefed. 2, thinking and researching. 3, catching up on relationships, checking in with the city, whether that was a constituent or an important stakeholder or a community. And then 4, recharging your batteries, because you forget, mayors are people too. You have to be able to sustain yourself, learn from, do the things you enjoy, spend time with your family, friends, music, whatever it is.
And then March of 2020, the rug got pulled out from under every plan anybody could have made. There could have been no ability to prep for that. What were your days behind the camera like?
There's 2 jobs to being mayor. One is the things you hope to see and that you want to manifest, your proactive agenda. But then there's the things you hope will never happen, but will, whether it's an earthquake, some sort of disaster, or in this case, which nobody saw on the horizon, a pandemic. Somebody told me early on, be a relentless communicator. Even when you're exhausted and have nothing left, you have to be that communicator with the city. You need to mobilize people that in the worst of times that they are not powerless, that they still have power even on the darkest days. I don't either have much sleepless nights in my life, but there are some nights, especially when I did the projections in my own head of what I thought the fatalities would be, where I couldn't sleep. And what a lot of people don't realize is I spent a lot of my time talking to families who had lost loved ones. And it was something I had to learn to do, and it takes a lot out of you, because each night, you're surrounded by death, you're surrounded by suffering, and it's something you have to do as mayor all the time, but it comes less frequently than the pace with which we saw, even when you go through some of the most painful and traumatic experiences or witness them. You become a strong person that can find joy in the moment, and so I hope some of that gives me the strength to know that while I saw that suffering, I also saw the most marvelous courage, the most generous love. And that's why every night I would sign off with strength and love to the city. I consciously wrote that because I wanted people to stay strong, and I wanted them to feel that love even when it felt like everything was moving the other way.
You know, as I just mentioned, I didn't know that those were things that you had done. What are some things that you think that people have never even considered when it comes to what it means to be the mayor of LA?
I think it's that informal power. People always, wrongly so, say LA isn't as strong a mayor system as other cities. I reject that in formal political science terms. Most mayors don't have a port, don't have their own airport, can't influence the metro. Sure, we don't have school district under the mayor's office, some health departments and things like that. It's a trade-off, but it's still an immensely powerful position. And what I really love is stopping by like a crew that is paving a street and just getting to know their stories and giving them maybe my challenge coin and knowing that it matters to them that the mayor stopped by. It's not about me, Eric Garcetti, or that kid that I meet, and I can look her in the eyes and say, and mean it, that I meet a lot of kids, but I see something really special in your eyes, and I know you're gonna do great things in this world, you're gonna contribute to your community, and I know that she'll keep that with her for the rest of her life. And if you lead with humility, whether it's going up to the supervisors and regularly meeting with them, or going with my fellow mayors, I think you don't recognize how much you can do by kind of giving power up. That's actually the exercise of true power.
So, as trivial as this sounds, I'm dying to know, when you have out-of-town guests, what is the first place you take them to?
It might not be the first, but if they can do it, I always insist, come with me for a hike in Griffith Park. If it's the weekend in particular, go up to Mount Hollywood, because you can see the valley where I grew up. You can see the west side. The best time to actually do it is sunset, because the city lays out like a bed of jewels. My favorite moment is twilight, when you can see still the orange of the sunset and the sparkle of downtown and the lights spreading out. I want them to kind of get a sense of LA that surprises them, because everybody has an idea of what LA is. And I think suddenly when they're stuck in nature in the middle of this big city, they're always blown away by that. Watch Griffith Park. They think of, fine dining is what defines cities, and that they have something they order out of a truck that tastes better than anything they've ever had. So LA is like a place of constant surprises.
Your dad said that, I guess he gave you the advice, and I want to say it correctly. The man entering the office will exit the office the same man. Was he right?
Oh, no, I think what he said is you got to know who you are going in, because it's going to be who you are going out. And I think his point was...
See, I messed it up anyway.
No, but you got
I got it close.
You got it close. And I've probably paraphrased him, so you're paraphrasing me, paraphrasing him.
There you go.
But I think his point was a really good piece of advice is your title doesn't define you. A lot of people get to become an elected official, and they think that's who they are. And they don't know who they are without that title. And so they let the job change them. Like, I'm the mayor. I remember our daughter Maya at school, one of her classmates a few years back came up to me and said, "Wow, you're the mayor, aren't you?" And I said, "No, I'm not the mayor." I said, "That's my job, but I'm Maya's daddy." Aww. And so, those things that define us, like you have to know who Eric is, because, some people carry their titles their whole life, but when I'm not mayor, I'm not mayor. People might call me Mayor Eric Garcetti, but there's going to be a different mayor. They should just call me Eric.
Are you glad you did it?
100%. I never wanted to be mayor. That wasn't an ambition I set forward in my life. Even just before I declared, and I was the last kind of major candidate, I think, to declare when I ran, I didn't even know that I wanted to then. And I'm so glad that I did. Even with all the hardships, with all the sacrifices, I don't care what people say my legacy is. The only thing I care about is I want, and I hope they've felt, them to know how much I love this city. Like, that is all we have. We either love LA and we're loyal to LA, and that unites us, or else we're just going to be a place that happens to be a city. In this place, we can all fight with each other, disagree, beat each other's throats, but I don't think that's who LA is, and it's not for me. And this job only made me fall in love with Los Angeles for all our imperfections and our challenges even more.
Make me cry. Make me cry.
I mean it from my heart.
Thank you. Thank you for all you've done. I truly appreciate it.
Thank you.
With Skid Row now entirely in her district, LA County Supervisor Hilda Solis has renewed resolve to fight for more resources to help overcome homelessness. She shares with us some of her efforts to assist those in encampments to find their pathway to stable housing. Well, her immigrant parents actually met in a U.S. citizenship class, so perhaps it was fate that she's devoted her entire life to public service. I'm delighted to be joined today by Hilda Solis. She is the LA County Supervisor for District 1. So nice to have you here.
Thank you so much for having me.
Well, you've had a remarkable career, and currently now you're serving the County of Los Angeles. I know you're very deeply involved in the County of Los Angeles Homeless Initiative.
Well, the Homeless Initiative came out of the whole Measure H, where the county actually asked our voters, the 10 million people that we represent, if they would help us achieve some semblance of addressing this issue of homelessness. And so there was a measure that allowed us to raise money, and that money goes every year towards helping to build out shelters, permanent, interim, as well as providing wraparound services, and really setting some good expectations of what the county can and can't do. In part, I think there's this whole idea that somehow you can just move people off the street, put them somewhere, and they're going to be okay. That's not necessarily how it works. Ideally, that would be fine, but it doesn't work that way. You have to assess the individual, diagnose them, understand what their illnesses are, if they have any, and what those barriers have been. And I know that it's important for us to understand where they are and to almost put our feet in their shoes, so to speak, and to understand how we can provide them the assistance that they need. And I know that there are many people that are wanting to seek this help, and there are many that are still resistant. So it takes time. It takes also mental health teams, treatment teams, health practitioners who can also help us and do some of that work out on the street. And that's one of the things that I'm really excited about, because now that I represent all of Skid Row, we're going to have a plan to address what is happening on Skid Row, working with the Women's Center, working with the providers there, working with our Department of Health, Department of Mental Health, and all the services, including the City of LA. And it's going to take time, and not everyone is going to be able to go back right out to the community. Our hope is to do that, but to do it with qualified clinicians and treatment, and with people that can, how could I say, that even have had lived experience to help draw people to understand, I can empathize with you, I understand what you're going through, and I want to show you what choices, not demand. You can't do that, but you can say, here are choices. And believe it or not, I think we'll be able to do a better job once we kind of put ourselves in that place where we're listening.
And along with what you said, you know, obviously there's a need for housing, there's a need for care, et cetera. And one of the opportunities might be sitting, you know, like right outside of downtown with the LA General Hospital. So I know that you're looking at that and hoping that might be part of the solution. How's that plan going?
Well, it's been a couple of years, I want to say at least 3 years, that I have been excited about looking at it, because it is, I mean, we're talking about many, many acres of floor space that if we could retool it, put in new elevators, electricity, plumbing, and divide it up into sections so that we could have up to anywhere from maybe 500 to 600 to 700 units of housing for people who need it. Because that's the number one priority. Right now we're short 500,000 housing units that we need to somehow find. Well, you can't build everything, but why not repurpose something like that that could be used?
It's been about 18 months since you opened the Hilda Solis Care First Village. I mean, that's a success story.
I think it's a game changer for a lot of people. I had no idea that we could transform containers that you see in the ports of LA and Long Beach, that they could be converted into homes. When I first thought of it, I thought, oh no, that doesn't sound realistic. But when I saw some models of what they could do, I thought, you know what, this is acceptable, because you can split the container in half and still have room for a unit, one unit to house one person that would have their own restroom. their own shower. They would be able to take care of themselves. And during the pandemic, I think people really understood you have to isolate. You can't just put everybody in a big congregate setting, and it made sense. But if you were to walk in to one of those facilities, there's 232 that were built, and they're stackable containers. You would say that you were at probably one of the nearest nice motels in town. And you'd have access to a Wi-Fi, you'd have your own television, your own refrigerator there, and in addition, once you enter into the program where these units are, you also are entitled to receive your meals there, and also entitled to receive wraparound services. So you get mental health counseling, you get assistance. You're also allowed to go work if that's what you need at the time to help get yourself back together. And at this facility, which happened to be a parking space that was going to be used for the Men's Central Jail, they were going to rebuild the jail. Well, since it's in my district, I said, why allow it to just sit there for time when we're not going to build a jail? Let's put some housing, interim housing for the unhoused. And we did it in 6 months. But it took everybody coming together and working shifts, hiring up local people, and then getting a provider in that staffs it. They even went as far as to put a dog park on the property.
This is a non sequitur, but what was it like being Secretary of Labor? Was it remarkable in all ways, or was it challenging, or was it, because it's a rather prestigious position, especially being a woman? How was that?
It was something that I could have never imagined, that one day I would go back and, back to Washington, D.C. and actually serve for the President of the United States. It was an honor, obviously. But I think for me, the challenge was always about how can we improve the lives of people, and how do we do it through the Department of Labor, working with other departments, community, and also the private sector and the public sector, as well as people who need our assistance, and making sure that we try to hit it right, that we get it right. And that's always the challenge. But for me, it was a lifetime opportunity, and I encourage people to live out their dreams, and don't be hesitant to seek out and risk, because let me tell you something. Somebody told me when I was in high school that I wasn't college material.
Oh.
Yeah, yeah. And of
Don't
course,
name names.
Of course, I just sat back and said, well, let's see about that. And that counselor said, Hilda, why don't you just become like an office clerk or a secretary?
Oh.
A secretary. So here, 40 years later or whatever, I could say, well, maybe he was half right. I became the Secretary of Labor, right? Different credentials.
But along those lines, I think that maybe what that has done is that has spurred you to make sure that you champion women, because that is something that is definitely part of your makeup. Why is this an important part of your being, to make sure that you elevate women in their voices and what they can do?
Well, I think women do things in a very different way. We can also be very deliberate in what we want to do and what we believe in. And I think that more women getting elected helps to bring about that change that sometimes is necessary, because we're looking at family issues, we're looking at children, we're looking at economic issues, we're looking at housing security, we're looking at everything. And as a woman, I think we just bring many times a different perspective. It doesn't mean that we're right or wrong, it just means that it's a different perspective. And take a look at the County Board of Supervisors. This is the first time in over 100 and something years that you have 5 women. And maybe it wasn't planned deliberately, but they rose to the occasion.
I cannot tell you how enjoyable this experience has been for me. Thank you so much. I am delighted that I had a chance to speak to you. And if people want to learn more about what you're doing, or what your office is doing, or just what's happening with the supervisors in Los Angeles County, what's the best way to?
They can call our offices directly at 213-974-4111, or go to 211, because if you're unhoused, if you want to know about job opportunities, you want to know a small business, wants to know how I can apply for a grant because I want to expand, or I want to start my business, go to 211, and you can get referred there easily. So the county's here to serve and try to do the best we can.
All right. Well, Supervisor Solis, it's been wonderful. Thank you so much.
Thank you.
And that's a wrap on this LA Currents.